Assalamualaikum warahmatullahi wabarakatuh. Alright, so this is the video that we're supposed to do in ILD during that time, but we have some fire training. Okay, without further ado, so this is the chapter 6. This topic we will be discussing on IT application in health technology. Alright, so in this topic, we're going to define what is telemedicine. Alright, it's quite easy. Tele, something between distance. Okay, medicine is medicine. It can be telemedicine, pharmacy later on. Then we're going to learn regarding two types of telemedicine and its benefits. Next, define and describe the concept of telepharmacy. Now we'll talk about the telepharmacy, right? The advantage and disadvantages of the telepharmacy, and lastly, type of IT prevention for the medication error. Okay, without further ado, we will proceed with the definition of telemedicine. Okay, so telemedicine is ability to provide interactive healthcare utilizing modern technology and telecommunication. Right, something like development of an apps. Okay, currently we are developing a new maternity application, which is I would say that we observe, all right, a condition of patient from afar. It's no longer can not, which mean that the patient can be at home. Okay, as I'm not sure if you notice that someone who treated at home with the caretaker in their own home, they are feel more energetic and positive way compared to be situated and in a control room such as like a hospital or clinics. Right. So, part of the telemedicine is one is consultation and monitoring. All right, for the consultation is usually between practitioner or doctor consulting a specialist or even a patient. All right, or even specialists among specialists. While monitoring, usually with a patient, someone like high blood glucose or cholesterol and so on, because right now we can check the cholesterol using a mobile apps. Okay, mobile machine, which is you just pinch to get the blood, so you can do it monitoring the result. We can show it to the doctor, which means we no need to travel to the health facility. Okay, those are among the benefit regarding telemedicine. So this type of telemedicine, we have two types. Okay, one what we call as a real-time synchronized, just like you are having a video call with a doctor or pharmacist, while the other what we call as asynchronized, all right, which means store and forward, just like this current video. Okay, I already recorded and then I share it to you, and you can open it whenever time you have or whenever time you like. Right, so what is the real time? As I mentioned before, which is both parties are present at the same time. All right, is direct, just like you call your father, okay, or your parents. Those are synchronized on time between a communication and real time, and sometimes we can do some video conference. Okay, right now we do have a lot of video call. Okay, WhatsApp, Telegram, even if you use a smartphone nowadays, all have the say the ability, the phone to have a video call. Those will be a real time. So asynchronous and not real time with stop and forward, just like contradicting the one that I did mention to you. Right now I'm delivering the lecture, all right, and then I save it and then upload it, let's say to YouTube or to our group. Okay, then you can look and even you can forward this particular video to the others. Okay, the same concept, but it's more to patient with patient with healthcare provider or specialist among specialists. Right, so there are a lot of things that why we are allowed this kind of technology nowadays, because as I mentioned before, we have a lot of advancement in medicine. Something like this one. I'm show you a blood glucose meter, spirometer, body fat analysis, ECG, and so on. And those kind of things can be bought, can be buy, and have every household can have it. Okay, and then from the result we can use during the consultation with the doctor. Alright, so actually this kind of thing is already we discussed about the benefit of the telemedicine. It's actually, I mean, everything is compiled together, alright, based on the previous slide. So, but this one we split it out and we put it into two ways. One is for rural physician, which means to the doctor or to the health provider, which is they are they are located in rural area, which is something like don't have proper internet, that one will be asynchronous. But if let's say they have a good internet but it's quite far to the conference rooms or the facilities, so but good internet, then can have synchronized method. So one of the benefit is will be they can have continued medical education courses, okay, from their own clinic. No need to go like you need to go to Shah Alam or Pulau Pinang or anywhere, because we are connected. Second, receive education from the specialist. Okay, this specialist not necessarily from Malaysia, it could be from other country. Okay, as long as we have the communication technology. Okay, either can be synchronized or asynchronized, doesn't matter. Third, enhance community confidence in local healthcare. Why? Because now the community on that particular place, although they are in a rural area, but they know that the physician, okay, are well educated and have continuing he or her study and upgrade her knowledge with the current technology and knowledge on the medicine, because everything can be ongoing. Lastly, better healthcare outcome for their patient. Of course, when we are well equipped, okay, good knowledge and understanding, right? So we can provide better quality services to the patient. Okay, next is toward the patient. Just now is toward the physician. Now toward the patient. Number one, cost saving. As I mentioned before, you do need to go travel. Okay, from far distance, like say you are from Sabah, Sarawak, or Johor, or Perlis, need to come to Kuala Lumpur. Okay, we have the telemedicine now. We can talk and we can discuss and even we can consult. Okay, but bear in mind this kind of technology are limited. Something like if you are required to give some biological samples, so that one is different story. Okay, and then loved one remain community with the family support. This is the one that I did mention earlier regarding a patient that stay with the family, their family in their own hometown are way better compared to a patient that stay in the hospital, okay, alone, or maybe one or two of their guardian, that's it. Okay, but if stay at home and follow and monitoring by the professional, that will give them a better support, okay, because they can see their family, their children, okay, which is being will bright up their spirit. Third, patient education courses. Okay, this one, of course, it's not just a doctor or healthcare. Even patient or even a civilian can attend. There's a lot of free and open to publics kind of discussion or education on a lot of things regarding healthcare. Alright, four, confidentiality of specialty examination visit. Okay, for example, like people who don't want to know that he is or she is sick. Okay, so then even neighbor do not know, because something like, oh, makcik mau pergi mana, alright, oh, pergi hospital. Okay, oh, sakit apa, and then maybe some of the disease that we regard as very private, then we don't want people to know. But okay, if we can do like conference meeting or like a video call right now like that, okay, so nobody know, it's just you in your own room. Okay, just like me doing right now, it's within my own room, nobody know what I'm doing here. Okay, it's just between me and my counterpart. All right, and then immediate urgent care. Okay, because everything is you can directly, okay, you can get immediate support, early diagnosis prior escalated medical episode, and lastly proper stabilized patient prior to transport. Okay, because you get a better education and instruction because before the ambulance to come, so you know what to do. Okay, and can be live from a video or from your phone. Okay, so those are that are two benefit, but there are a lot of benefit within these two category, to the health provider and even to the patient. Okay, next is telepharmacy, okay, or telepharmaceutical. Again, it's something just like telemedicine just now, but this one more to a pharmacist. All right, a telecommunication to patient in the location where may not have direct contact with a pharmacist. Alright, so what are the services provided? There are drug therapy monitoring, patient counseling, refilling, authorization prescription, monitoring, remote dispensing, and even video conferencing. Okay, this is allowed that since there is no pharmacist, okay, pharmacy assistant can get a guidance, okay, through a video to dispense on the separated area. Alright, so just same like thing that just previously, but this one toward a pharmacy. Alright, so this is overall regarding advantage and disadvantages. Okay, we go for the advantages first. Number one, potentially give patient more remote location access to professional pharmacy. Second, they can lowering cost. Okay, no need to cost for travel. Okay, then to accommodate and so on. Alright, this is lowering cost. Third, sharing pharmacies between site can also decrease cost existing facilities, which mean that we don't need to have a lot of pharmacy setting on each location. Okay, because now one location can cater, let's say, a whole district. Okay, because everyone is connected through a network. Okay, fourth will be reduce patient waiting time in the hospital. How about, however, this kind of technology also have some disadvantages. Number one, this is decreased human interaction, because right now we are really emphasizing humanized medicine, humanized services. Okay, which means to a certain extent, yes, we can use technology, but another extent another side we want to have human touch. Okay, empathy and so on. Those are actually really critical in any part of services. Alright, third, increased risk of error when medical services delivered in absence of registered professional, because this could be, alright, because this is not on-site professional, an error might occur, might be during the analysis you have some connection error or something like that, or disturbance on the professional who are guiding over there. Okay, that cause miscommunication on the site. Alright. Third, increased risk for protected health information may be compromised to electronic information storage and transmission. This is a lot of things. Okay, even the bankers, a banking system use this system. Okay, these are all will be an issue, especially a threat from a hacker. Okay, the next topic about CPOE, which is what we call computerized physician order entry. Okay, as the name itself, which is referring to ordering the test and medication, as well as other treatment for patient using computer. That's what we call computerized. So the advantage is that they decrease delay in order completion, because everything is online and digitalized. Whatever you type here immediately get to another department. Reduce error related to handwriting. Again, okay, you know that you have your own writing style, I also have my own. Okay, but if everything we go just, let's say, use computer is Times Roman, then it's Times Roman. Okay, it's quite easy to read that way. Allow order entry to point care on or the outside offsite. Provide error checking for duplicate or incorrect doses of the test, because there is a system that can monitor and counter if there is an error occurred. Simplify inventory, reduce patient waiting time, since this is number one, the last can be complementing the first here, so that why is shorter patient waiting time. The risk is prescriber and staff might be inexperienced, okay, using the technology or the system, might cause a slower entry of order, but this could be temporary, because the more time he or she spend on that, they will be an expert. Okay, this is the risk, but this is for a short term. Second, shortcut or default selection can override a non-standard medication regimen for elderly or underweight patient, resulting in toxic dose. This is also could happen. Alright, so electronic prescription is again is using a computer-based, okay, electronic generation, transmission, and filling on the medical prescription that taking place rather than the paper. Now is go to like online fax prescription. Right. Another type of definition that you're going to learn right now is about electronic health record and electronic medical record. So what are the differences? Okay, number one, EHR is referring to a systematic collection of electronic health information about individual or population. Okay. Second is patient record created in ambulatory environment. Okay, so these are the two differences. Okay, health information. So what is health information technology? It's referring to the application information process involve both computer. You remember, both computer hardware and software that deal with number one, storage, retrieval, sharing, and use of healthcare information, data, and knowledge for communication and decision making. Right, there's a lot of point here. Okay, although it could be, you need to simplify in your own way, okay, in your own word to make you easier to remember. Okay, although if this kind of question is still 1 or 2 mark, but there are a lot of point that need to be spelled out, then it will be reflecting what is HIT. So informatic are referring to science of information, the practice of the information processing and engineering information system, right? Informatics, okay, that's it. Then when it combined to health informatics, it means that the intersection of information science, computer science, and healthcare. Okay, the health information system describe the use of sharing within the healthcare industry with contribution from a computer, mathematics, psychology, and so on. Okay, right? Okay, now the informatics are compulsory to have data science, computer science people, and even bioinformatician. So the benefit is what the system does is actually they allow early detection of infectious outbreak around the country. Okay, because it's everything are connected. Okay, you Sabah, Sarawak ke, Negeri Sembilan ke, Perlis ke, all everything you submit all the data to the database. So immediately the system at the central will analyze the data and see if there is possible outbreak. Okay, if there is, they give a good warning and we can do a lot of precaution movement. Evaluation of healthcare based on value enabled by the collection of the identified price and quality information can be compared. Alright, so that's all. 16 minutes or 17 minutes. Okay, this is covering for your chapter 6. If you have any question, you can ask. Alright, thank you, and try to WhatsApp or email, or you can meet me. I'm always in the office. Alright, okay, that's all, and assalamualaikum, and have a nice day.